For my next PowerPoint, I chose to do Infectious Diseases Manifesting on the Skin and Eyes, Chapter 19. We'll start off talking about the skin, and we'll talk about those anatomical features. This is your skin, your hair, your nails, your sweat glands, and your oil glands. So we know with your skin, you have different layers of skin. But your skin helps protect your body from those external factors. Um, it contains the secretions that will typically kill out bacteria. It also contains melanin, which helps to fend off those harmful UV lights. And skin also helps us to regulate our body temperature. It aids in helping the skin kind of be a little cooler on those hot days. So here we have hair, and this keeps us warm by preserving our body heat, kind of like an insulation, I guess you'll say. We have this around our nose, skin, and mouth, and this is to keep dust and foreign particles out of those areas. We also have our eyelashes and eyebrows, which help keep harmful light and particles out of your eye. And this isn't the last time you'll hear about eyelashes and eyebrows. We'll go into those a little later. Next, we have our nails. These are in place to support the tips of our fingers and toes. It helps protect them from injury. They also prevent viruses and bacteria from entering our body. One cool thing about our nails is that it can be an indicator of our health. Illness can affect growth, and sometimes certain diseases will cause your fingernails to be a little different. COPD patients may have those kind of club fingers. So nails are actually something we don't think about much, but they're a big thing to us. Our sweat glands, these also help control our body temperature. Um, they remove waste from the body, such as sodium and such. Um, our sweat glands help us by moistening the palms of the hands, and it helps us to be able to grip things a little better. And last, we have our oil glands. So these produce and secrete sebum, and that sebum is used to lubricate the skin to protect it against friction. It also helps reduce water loss from our surface area, and it coats and moisturizes and protects our skin. Next, we'll talk about those natural defenses that are present on the skin. So we have our keratinized surface, sloughing, low pH, high salt, and those lysozymes. First, we'll talk about that keratin. This protects epithelial cells and promotes growth. It also holds those epithelial cells together to support the stress they're under. It also strengthens the skin and helps the skin maintain that elasticity. Sloughing. This is the removal of dead skin cells. So if you have a wound and you notice the skin around it is kind of sloughing off, that is so the new skin cells can be pushed to the surface to replace the ones that are dying. It's a very important process of wound healing. Our skin has a low pH, and this helps neutralize harsh surfactants and inhibit growth of certain bacteria. It also helps keep the skin's normal microbiota in check. Our skin has a high salt content, which helps prevent water loss, fight off bacteria, and it stockpiles at infection sites to aid in healing. And last, we have these lysozymes. These will digest those bacteria or fungal walls, and they can also punch holes in the cell walls of the bacteria to cause the contents to leak out. So very important. Next, we'll kind of talk about the normal biota that is found on the skin. First, we have Staphylococcus epidermidis. This is involved in the defense against pathogens. Staphylococcus aureus. This is the leading cause of most skin and soft tissue infections because you get that puncture and that's already on your skin, so it's kind of just introduced into that tissue. Micrococcus, and these actually help promote skin health. And then we have the Corynebacterium, and this is mostly seen in diabetics. This is kind of those rashes you'll see on a diabetic, the like reddened pinkish rash. So here we're going to talk about some infectious diseases that happen to the skin, and we have MRSA, cellulitis, impetigo, and gas gangrene. MRSA is called methicillin-resistant Staphylococcus aureus. It is a gram-positive bacteria. It is contracted through contact with infected people or items that are carrying that bacteria. The area will typically be red, painful, warm to touch, and swollen, and it may have a not so much a boil, but look like a little pimple, and it will be full of pus. Um, and that typically doesn't get any better, it just gets worse. 7 to 10 day treatment of antibiotics is the main treatment. These can be Bactrim, clindamycin, minocycline, linezolid, or doxycycline. Next, we have cellulitis. Cellulitis occurs when a deep infection of the skin is caused by bacteria. This bacteria will enter through the break in the skin and cause fever, fatigue, pain in the affected area, skin redness or inflammation, a skin sore or rash, and the skin will be warm to touch, and it may be tight. That skin may also look pitted, kind of like an orange, and blisters can appear. It's mainly caused by Streptococcus and Staphylococcus. Antibiotic treatment includes penicillin, cephalosporins, and clindamycin. Impetigo. This usually occurs in the young children and infants. The main symptom is those red sores that'll form around the mouth. These sores will rupture and ooze for a couple of days, and then they'll turn into those honey-colored crusts that you'll see in the picture. They typically, impetigo, that bacteria typically enters the skin through a cut, insect bite, or skin damage like eczema. If untreated, it can lead to deeper complications of the skin, such as cellulitis. Oral or topical antibiotics are used for the cure, like amoxicillin. Last, we have gas gangrene. So pretty nasty stuff. This is a lethal infection of soft tissue caused by the Clostridium species. It typically presents itself as necrosis of the tissue, and it is a foul-smelling gas, and it's usually emitted from that wound area. It happens when the supply of blood to a part of the body is interrupted. That can be caused by injury, infection, or an underlying health issue. The area may have severe pain and tenderness, local swelling to massive edema, skin discoloration, and hemorrhagic blebs. Debridement and antibiotics are usually the first steps taken to try to cure this, but if the treatment does not work, that affected limb may have to be amputated. Now we'll talk about some anatomical features of the eye. This includes the conjunctiva, cornea, eyelids, eyelashes, and the sclera. The conjunctiva provides protection and lubrication for the eye. It produces that mucus and tears. It prevents the microbial entrance into the eye, and it provides a covering for that sclera. The Cornea, this will protect you from the UV rays. It's responsible for 65% to 75% of the retractable light. It performs the initial refractions onto the lens and then further focuses that light onto the retina. Our eyelids, these are the adequate tear film distribution across ocular surface. They are very important for tear drainage. They protect our ocular surfaces, and they also contain the glands that lubricate those ocular surfaces. Eyelashes are our first line of defense because they keep the dust, lint, and other debris out of the eye. When the eyes are open, the eyelashes will catch some debris, but when the eyelashes are closed, that is an impenetrable barrier. Nothing's getting through. And last, we have our sclera. This maintains your eye shape and protects your eye from injuries. Attached to the sclera are muscles that help move the eyeball, and your sclera also supports the wall, is a supporting wall for your eyeball. Here we'll talk about some natural defenses of the eye. So we have eyelids, eyelashes, tears, lysozymes, and lactoferrin. So we've talked a lot about eyelids and eyelashes, and it's kind of repetitive. We know that they keep that harmful UV light out, and they keep the harmful debris out of the eye. Tears help keep your eyes moist. They can wash away those particles that irritate the eyes. They help focus light so you can see clearly, and they also protect your eye from infections and irritations. So lysozymes are abundant in our tears, and they kill gram-positive bacteria. They also protect the eye against certain pathogens. Lactoferrin is actually secreted from our lacrimal glands. They maintain that homeostasis of our ocular surface, and they help promote corneal wound healing. Here are some of the normal microbiota of the eye. Excuse me. We have Staphylococcus, Streptococcus, Propionibacterium, and Corynebacterium. And last, we're going to go into some of those infectious diseases of the eye. So we have conjunctivitis, trachoma, keratitis, and river blindness. Here we have a picture of conjunctivitis, and we all know this is pink eye. This is an inflammation of your eyeball and inner eyelid. So this can be caused by allergies, bacterial, or viral infection. It is extremely contagious and is spread when someone comes in contact with that infected person's eye secretions. Symptoms include redness, itchiness, watering of the eyes, and sometimes discharge or crusting. Conjunctivitis can sometimes be relieved on its own, but for certain cases, antibiotics or steroids may be used. This is trachoma, and it is also known as blinding trachoma because it is the leading preventable cause of blindness worldwide. Extremely contagious through touching a contaminated surface, saliva, or skin-to-skin contact. It is caused by certain subtypes of chlamydia trachomatis. Side effects are corneal scarring and eyelid deformities. Antibiotics will treat the early stages, but surgery is needed for the later stages. Here we have keratitis. This is an inflammation of the clear tissue on the front of the eye, the cornea. It is caused by infection, injury, disease, or wearing contacts for too long. Symptoms can include redness, pain, or blurred or decreased vision. This can be caused by bacteria, fungi, or parasites. Antibiotics are the typical cure for this type of condition. And last, we have river blindness. So this is a parasitic tropical disease that affects the skin and eyes. Spread by repeated bites from the infected black flies and most common in remote African villages. It's extremely rare, but they can lead to changes in blindness if left untreated. Symptoms don't appear until after 1 or 2 years of the initial infection, but these include itching, eye redness, or swelling lymph nodes. Antipyrenic meds and antibiotics are your preferred treatment.